risk for constipation, powerlessness, hiatal hernia, impaired mobility.
Hiatal hernia.
Hiatal hernia, yes. Good job. All right. Remember that we talked about the different characteristics of critical thinking, what makes a good critical thinker, and their intellectual humility, intellectual integrity, those. I think, can't remember how many there were. Um, so, if you, as the LPN, want you wish to learn why a patient's lung sounds have crackles, and you ask the doctor during morning rounds, which critical thinking attitude is are you exhibiting? Does anybody know?
Humility.
Very good. Yes. Humility. In other words, you are not afraid to ask a question. You are not afraid to say, I don't know. I need to find out. Um, Dr. Smith, I was listening to so and so's lungs this morning, and I heard these like, popping sounds, or it kind of was coarse. It kind of sounded like if you rubbed your hair by your ear. Is that crackles? Could you listen and tell me if that's what? Yep, that's intellectual humility. Very good. Does that make sense, everybody?
Yes, ma'am.
Yes.
All right. Good. All right. So, what's that important reason critical thinking is useful in the nursing process? What can it
Better
do?
goal or outcome for the patient.
Yeah, there you go. Yes. It can lead to a better outcome for the patient. Excellent. It can lead to a better outcome for the patient. Very good. Okay. Now, I have 4 different patients. You listen to morning reports. Which one of these patients are you going to go to first? Are you going to assess first? Is it and this is all about Maslow's hierarchy of needs. Okay? So you want to meet the physical needs, the life-threatening needs first. That's what you want to think of. Okay, is it the patient who states, no one cares about me? Is it the patient who needs discharge teaching? Is it the patient who needs help to ambulate? Is it the patient whose temperature is 106?
The temperature.
Panic 106.
Yes, the temperature. That's life threatening at this time. Very good. Okay. All right. Again, we're talking those attitudes. So it's intellectual, critical thinking attitudes. If you have um, 2 nursing students and they're talking, which one of these demonstrates intellectual courage? Is it when they consider being in the other person's situation? Is it when they listen to each other's point of view regarding the use of patient restraints? Is it expected proof that the use of restraints is safe? Is it conducted additional research on the use of restraints in patient care?
The point of view.
Point of view.
The point of view. Absolutely. That demonstrates intellectual courage when they can listen to each other's point of view regarding the use of whatever they're talking about. In this case, patient restraints. So even if
Does
you
anyone
don't
else see
agree,
frozen screens?
what was that? Or is your screen freezing?
Don't say it's just me.
I think
Sometimes
it's just
that
you.
happens. Yeah, sometimes that happens. If you want to take your camera off, see if that helps. Sometimes you got to go out and come back in, couple things. So, all right. Remember that even if you don't really agree with someone, as long as you can listen to their point of view, that shows intellectual courage. All right. All right, you guys, if you have a patient who has a fractured femur, and then they've got pain like on a number 8 on a scale from 1 to 10, and their pain is 8, okay, and their medication is not due for another 50 minutes, what would you do? Would you notify your registered nurse? Would you reposition the patient? Would you go ahead and give them medication in 30 minutes? Would you tell the patient, well, it's too early for your pain med?
Notify RN.
Notify the RN. Why did you go with that one instead of reposition the patient?
It's up. The number was up.
Because of the fractured femur.
Yeah, it's a fractured femur. That hurts, people. And if their pain is a number 8, just by repositioning them is not going to bring that pain level down enough. You got to notify the RN. Either they got to get another pain medicine ordered, or get the, what do you call it, the okay to give them something right now. Whether it's the same med and just be able to give it early or whatever. Something needs to be done. Good job. All the other ones are not good enough. Not for that level of pain. Good job. Okay. So, what is the definition of critical thinking?
Using knowledge and skills to make the best decisions in patient care.
Excellent. Verbatim. Very good.
Kayla's got the test in front of her.
What?
No, I don't. How?
What?
How am
I'm
I-
just joking. I'm just joking.
Yeah, I know. She wouldn't have that. Yeah, there's no way she would have that. Yeah, she just studied. That's excellent. Good job. Sometimes people are good at picking this up when they read this or listen to my lecture. And I'm not saying that to brag about me and my lecture. I'm just saying that some people really have a knack of picking up the things that I think are important. Do you know what I mean? Do you guys know what I mean? After you heard me lecture, do you guys get what I'm saying?
Yes, ma'am.
Yes, ma'am.
Yeah. Some people are real good at that. And other people, maybe aren't not. They were distracted or sleeping or something. So, but yeah, critical thinking is using your knowledge and skills. And that's probably how I said it the first time. And that's why she remembers it. To make the best decision possible in patient care. Very good. All right. Okay, guys. This one you may or may not remember. When you're planning care for your patient and you're setting goals for your patient, who's included?
The patient.
The patient.
Oh, you know what? I just might have to brag about you guys. You knew this better than my third trimester. Good job. Yes, they put the doctor. Very good. It's the patient. The patient needs to be included. If the patient isn't included, then when it comes time to implement whatever, they may not do it. They may not do it. Good job. All right, guys, how would you best document a wound if you see that, if you note that it has serous sanguineous drainage on it?
It'd
Would
be like
you,
pink.
what's that?
Wouldn't it be pink?
Yeah.
And maybe
You would
palish
say-
also.
What was that?
Maybe palish to add to the pink.
Absolutely. Pale pink drainage. And then you would put what else?
You would note how big it is.
That's it. There you go. Very good. So you would say something like pale pink drainage, 2 centimeters by 1 centimeter. Noted on dressing. Very good. Excellent. And they knew that by that little chart that I gave at the end of the PowerPoint where it gives descriptions of wounds. Very good. Excellent. Okay. All right, guys. Which data would you document as objective? Remember, we have subjective data and objective data. Which one of these is objective data? Patient is pleasant. Urine output 300 milliliters. It has been a good day. Patient's appetite is poor.
An output.
The urine output.
The urine output. Very good. That is completely objective. Excellent. Everybody understands that, right?
Yes, ma'am.
Yes, ma'am.
Yes, good.
Yes.
Good. Okay. You guys, what do you think is the most important or most appropriate nursing diagnosis when somebody is recovering from surgery?
Pain.
Pain. There you go. Bingo. Again, my students missed this one, so excellent job. Yeah, acute pain. So very good. And how do you know that? How do you know that, Miss McBride? Well, first of all, don't read into any questions. They don't give you anything else. And what happens after surgery when you're being cut open or any kind of thing, you're going to have pain. That's just going to happen. So that's one of the most important. Now, if don't get that mixed up with, and I hope I don't confuse anybody, a different type of question might be, of the following, which one is the most important? Well, that changes the whole thing. The person, it could be something like, of the following, which is the most important from this patient who's just had, or who is post-op 1 day. And it might be something like the patient is short of breath or something like that. Well, that changes the whole question. Does everybody see that?
Yes.
Yeah.
Okay. So, all right. So in this case, it's pain. Very good. All right. So again, of those attitudes, critical thinking attitudes or behaviors, if you have a patient who's experiencing side effects to a medication and they want to know, you know, why this is happening. And they may go to their nurse and say, so-and-so's having some side effects. And the nurse says, oh, yep, I know that. It's okay. Don't worry about it. But she doesn't really answer your concern, or you're still worried, or you're still concerned. So you conduct an internet search, or you get on the internet or one of your resources that you have at your work, and you look it up, and you're studying more about these manifestations that your patient's experiencing. What is that called? What kind of attitude is that?
Perseverance.
Perseverance. Very good. Intellectual perseverance. Good. All right. Which outcome would best be used to guide the patient's care who has fluid volume deficit? Okay, so if you're identifying an outcome or a goal for a patient with fluid volume deficit, which one of these outcomes would you use to best guide your care? Would it be fluids the patient likes will be at the bedside? Fluids will be at the bedside for the patient. Measure fluid intake daily. Patient will to intake at least 2,000 to 3,000 milliliters every day.
The last one.
The last one. The last one is a SMART outcome. Very good. It is patient specific. It is attainable. It is realistic. You can measure it, and you have it timed daily. Good job. The others don't fit that. Excellent. Okay. So now you're caring for a patient, has a diagnosis of fluid volume excess. What information would you use as the LPN to determine if the care was effective? So this patient has a diagnosis of fluid volume excess. So which care would you use, or information would you use to determine if the care was effective? Would it be discuss the patient's care plan with the RN? Would it be measure the patient's daily weight? Would it be restrict the patient's fluid intake? Would it be teach the patient to monitor fluid balance?
Daily weight.
The daily weight. Very good. Why did you pick that one?
I mean, with the fluid volume, I mean, it makes sense that you can tell the difference with the weights if you're weighing.
It's measurable. Very good. Yes. Yes. Excellent. Very good. It's it's a measurement. You can actually see how much. Very good. Okay. All right. I know you guys know this. In the nursing process, because you already told me, which part or phase of the nursing process can the LPN perform independently?
Implementation.
Implementation. Good job. Great. You guys are a great class. I can't wait to have you in third. All right. So remember I talked about how to write a correct nursing diagnosis. I remember I think I told you guys that when you have an actual problem, there's three parts. When you have a potential problem, there's 2 parts. Okay, so when you have an actual problem, you write the problem in NANDA, then you write the etiology or the related to, and then you write the signs and symptoms. That's the 3 parts. When you have a potential problem, you write the NANDA problem, and it will be something like at risk for, patient at risk for constipation, and you may say it to yourself, patient has the potential for constipation. And then you put 2, second part, related to pain medicine or opioids, okay? Or immobility, something like that. Whatever it's related to that you're worried that they're going to get constipated. All right, does everybody understand that? The difference between writing the 2 types.
Yes, ma'am.
Okay, so now you've got a patient who has a painful back injury. Let's say it occurred 7 months ago, this back injury. I'm going to give you some nursing diagnoses. Which one is the best 3-part nursing diagnosis to fit what I just told you? Painful back happened 7 months ago. Acute pain related to inability to sit, as evidenced by muscle spasms. Acute pain related to patient's pain rating of a 6, as evidenced by muscle spasms and nerve compression. Chronic pain related to muscle spasms, as evidenced by patient's pain rating of an 8 and difficulty walking. Pain, as evidenced by a herniated lumbar disc.
Chronic pain related to muscle spasms.
Chronic pain.
Very good. Okay, so what tipped you off right away?
Because the injury happened 7 months ago and he's still in
That's
pain.
right. It's not acute pain. It's chronic pain. Very good. And yes, it is written very good. Chronic pain related to muscle spasms. That's your 2 parts, as evidenced by their pain rating of an 8 and difficulty walking. Those are the signs and symptoms. Very good. Good job. Everybody okay?
Yes.
All
Yep.
right.
Yes, ma'am.
Okay. So you, the RN that you're working with, she implements an intervention to improve a patient's appetite. So again, working on the nursing process. So after implementing the intervention for like 2 meals, you as the LPN make a note that no improvement in the patient's eating has happened. What action are you going to take then? Are you going to develop a new plan of care? Are you going to revise the patient's outcome to one that maybe is more achievable? Are you going to provide the data to the RN to assist in the evaluation of the plan? Or are you going to collaborate on a new nursing diagnosis with the RN?
Provide the data to the
Provide
RN.
it to RN.
Very good. Excellent. So you note it. You're going to go give the information to the RN. Very good. And you're going to assist. And that's the part that's assisting in the evaluation phase of the plan. Excellent. Very good. Okay. Okay, now I got another group of patients. Which one do you think you want to go to first? All right, you got morning report on them again. And these are your group of patients. Which one are you going to go to first? The patient who's scheduled for the MRI due to back pain. The patient with pneumonia who's short of breath and anxious.
Mm-hmm.
The 2-day post-surgical patient who's got pain of a 6. And the patient reporting constipation and stomach cramps.
The second one.
The second one.
Yes, and why? Why are you saying that one?
Airway.
Airway
Shortness of
breathing. Very good. Life-threatening. Maslow's hierarchy of needs. Excellent. Very good. In this situation, you got the one that's more important. So problems of pain and constipation and scheduling of the tests, they're important, but they're not immediately life-threatening like that shortness of breath could be. And why do you think the patient's anxious? I would be if I was short of breath. Wouldn't you?
Yes, ma'am.
And anybody who has asthma knows what that feels like. Not a good feeling to be short of breath. Very good. Okay, you guys, I know you all know this, but let's do it for, I want to say, shits and giggles. All right, go ahead again and tell me the nursing process in order, the steps.
Assessment.
Nursing diagnosis.
Uh-huh.
Planning.
Plan.
Implement.
Implementation. Evaluate.
Good job. Boy, do I like how you guys did that. You all took turns. You let each other speak. Wow, God bless you. What a good group. Yay. Okay. And you all are being involved in this, and I appreciate that. You're doing exactly what I asked you. So, you know what? I just might give you guys all hundreds today for a daily grade. I think I'm going to. Yep, absolutely. All right, good job. Okay, the nurse is determining a patient problem, okay? So, if you are determining a patient's problem, what step in the nursing process are you doing?
Nursing diagnosis?
Yes. Yes, you're identifying the nursing diagnosis. When I was reviewing with my students, they all wanted to say assessment. And I said, well, now let me say it again. You are determining the patient's problem. I didn't say you're gathering data. I didn't say you're assessing. I said you're determining. And then they got it. But you guys got it right away. Good job. Nursing diagnosis. So if you want to, if you hear something like that, when the nurse is determining the patient's problem, you can say to yourself, okay, she's identifying the patient's problem. So what step of the nursing process is she in? Well, identifying the problem is nursing diagnosis, right?
Right.
Yeah.
Right. Very good. Very good. Okay. So now the nurse is preparing to determine if a patient is meeting planned outcomes. So if the patient is meeting the planned outcomes.
Evaluation.
Oh, okay. Yeah, but hang on a minute. Okay. So, what measurable information would you use to make this determination?
Objective observations.
Objective observations. Good job. Yes. So, if you were preparing, or if the nurse was preparing to determine if the patient is meeting their planned objectives or outcomes, what measurable information would you use? Objective observations. Very good. Does that make sense? Is everybody with me?
Yes, ma'am.
Good. Good. So a measurable means that an outcome can be observed or is objective. You can observe it, it's objective. Very good. And that's the best way to determine, well, at least in this situation that I just gave you. All right. What is evidence-based practice?
It's a practice that has like studies shown to prove outcome.
Very good. Yeah, you are definitely on the right track. Evidence-based practice guides nursing decisions to optimize effective care. Very good. Guides nursing decisions to optimize effective care. Good job. All right. Now, what part of the nursing process are you in if you are interviewing or the RN is interviewing the patient to obtain a health history? She's also reviewing the lab. She's looking at diagnostic tests. What part of the nursing process is she in?
Assessment.
Assessment. Very good. Yes. Okay. All right. So again, with evidence-based practice, what is the most important reason for using evidence-based practice?
It has the most research to back it up, so we know more likely than not this is going to work well.
Very good. So, what are you doing then? You're using it because you know it's the best. So what's it going to do for the patient?
The best care for the patient.
Yep. There you go.
Outcomes.
Yep. It gives you the best care. It optimizes your care. Very good. Yes. Excellent. It optimizes your care. Good job. Evidence-based practice. Okay. What step in the nursing process are you in if you have a patient with abdominal pain and you're determining that the top priority is to give them or to manage their pain with medicine? What step? Planning. Good job. Planning. Excellent. All right. Okay. All right. If you have an unlicensed assistant and you're talking with her or him about patient care assignment, and you as the nurse explain the reason for turning and repositioning the patient every 2 hours. Now, why did you do that? Why did you include this information? Was it to guarantee that the patient will receive morning care? Was it to help the tech focus on the action being performed? Was it to help the tech with time management of tasks to complete? Or was it to ensure that evidence-based care is provided?
To ensure that evidence-based
Or
is related.
is provided.
That's exactly right. Yes. And when you guys are nurses and you're talking to your techs, if you help and teach them and explain to them the reasons why you want something done, that helps ensure the evidence-based care is being provided, because then they understand and they're more likely to do it because they know why they're doing it. Does that make sense?
Yes, ma'am.
Very good. Very good. Good job. Okay. If you have a patient, let's say this patient, okay, we'll just say that it's a post-op patient and they have pain, they're complaining of pain, and you administer pain medicine. When you're medicating the patient, what step are you performing in the nursing process?
Implementation.
Implementation. Very good. Excellent. Okay, now this one, you have a patient who, let's say they have maybe chronic bronchitis or something like that, or maybe they just have bronchitis, or they're in the hospital because maybe they have pneumonia. Okay, and they are having trouble with their breathing. So you notify the respiratory therapist to go ahead and administer treatment. Now, after the treatment, you reflect on it and you determine that the goal of relief was accomplished. So by you determining whether the goal was met or not met, what part of the nursing process are you doing right now?
Evaluation.
Evaluating. Very good. The evaluation step. Good job. I think you guys understand that. Yeah, very good. Okay, now let's talk objective and subjective data again. I'm going to give you some data. You tell me which one of these is objective. Oh, objective data. Patient complains of visual disturbance. Patient demonstrates facial grimacing. Patient complains of being nauseated. Patient reports feeling depressed.
Facial
one. The grimacing.
Grimacing.
The grimacing. Very good, because the patient is doing it is what you're saying. You're looking at her and she's demonstrating grimacing on her face. That's subjective. She's not telling you, you're seeing it. Very good. Excellent. All right. So, this is more than one answer, you guys. More than one answer. So you're collecting data and you identify diagnoses, nursing diagnoses to guide the patient care. Which diagnoses did you document correctly? Acute pain, diabetes, pancreatitis, activity intolerance, impaired physical mobility.
Acute pain.
Yeah.
1, 3, and 4.
Ability and activity intolerance.
Very good. Wow. Yes, acute pain is a nursing diagnosis. Activity intolerance is a nursing diagnosis. Impaired physical mobility is a nursing diagnosis. Diabetes is a medical diagnosis. Pancreatitis is a medical diagnosis. And you wanted nursing diagnoses. Very good. Excellent. Okay. It's another more than one answer. All right. Now you got a patient. This patient has a family history of diabetes. And this patient is experiencing high blood glucose levels, confusion, an unsteady gait, and dehydration. Okay, so this patient has a family history of diabetes. This patient is experiencing high blood glucose levels, confusion, unsteady gait, and dehydration. So which nursing diagnoses would you identify as appropriate for this patient? Would it be deficit fluid volume, hyperglycemia, diabetes, dehydration, risk for falls? More than one answer.
Risk for falls.
Yep.
Fluid volume deficit.
Yep.
Yeah.
Very good. Any more?
Wouldn't be dehydration.
No, ma'am.
No more.
No more. Excellent. Excellent. So, nursing diagnoses, deficit fluid volume, that's for the medical diagnosis of dehydration. Deficit fluid volume is a nursing diagnosis. Hyperglycemia is a medical diagnosis. Diabetes is a medical diagnosis. Dehydration is a medical diagnosis. Risk for falls is a nursing diagnosis. Very good. Does everybody understand that?
Yes.
Anybody having trouble with that? Okay. All right, guys. Now we're talking. Okay, first of all, more than one answer. And this is regarding dependent interventions versus independent nursing interventions. You are implementing dependent interventions when providing patient care. What actions are dependent nursing interventions? Give Tylenol 650 milligrams, PO every 4 hours, PRN pain, bathroom privileges as tolerated, turn patient every 2 hours, low sodium soft diet, wet to moist dressing changes every 6 hours while awake.
Wet to dry dressing change.
Yep.
Bathroom.
The Tylenol.
Yep. Bathroom, Tylenol,
And the low sodium salt.
and the low sodium. Very good. Those are dependent. You need doctor orders to give the Tylenol. You need doctor orders for the activity of bathroom privileges. You need doctor orders for the low sodium diet. You need doctor orders for the dressing changes. You do not need doctor's order to turn the patient. That's a nursing independent, and you want dependent. Very good. Anybody have trouble with that? Okay, good. All right. What is the definition of the nursing process? And this is the one kind of out of the book. It's pretty, you may or may not know it.
Decision-making framework.
Yeah, that's it. Yeah, it's a decision-making framework used by nurses to determine the needs of patients. Now, I'm going to say this, and I want you guys to do this all the time, not just for me or not just for my tests, but all the time to improve your accuracy on test taking. One of the strategies is very simple. Slow down and read everything carefully. Don't be reading quickly and then you miss a couple of words and pick the wrong answer. Because there can be similar answer choices. Words are in the phrase are very similar. Maybe one word is different, which gives it the edge, which makes it the answer. Does everybody understand what I'm saying?
Yep.
There's one thing to know your information, what you guys would call being smart. That person's smart, okay? Intelligent. But there's another thing to being able to apply that intelligence and think critically and read carefully. Does everybody understand what I'm trying to say? Okay. I'm guessing you do. All right. Let's move on.
Ms. McBride, can we have
Yes.
a 10-minute break?
Yeah, do you need a potty break?
Yes,
or
please.
a coffee break or a pop break or some kind of break? We sure can do that with you guys. Absolutely. So it's 12:36. You want to come back? Blah, blah, blah. Want to come back at 1 o'clock?
Okay, that works.
That works. You are welcome. See you at 1 o'clock.
Thank you.
You're welcome.